Ceftolozane/tazobactam, also known as Zerbaxa, is an antibiotic used to treat various bacterial infections. It belongs to the cephalosporin class of antibiotics and works by inhibiting the growth of bacteria. It is important to take this medication as prescribed by your healthcare provider and to complete the full course of treatment. The dosage and frequency of administration will depend on the specific condition being treated, so it is crucial to follow the instructions provided by your doctor. It is typically administered through a vein, and the timing of administration will also be determined by your healthcare provider. Be sure to discuss any concerns or questions with your healthcare provider regarding the use of Zerbaxa. When using Zerbaxa Vial, it is important to follow your doctor's instructions for injection into a vein, usually every 8 hours. The dosage is based on your medical condition and response to treatment, and for children, it is also based on their weight. If using this medication at home, make sure to learn all preparation and usage instructions from your healthcare professional. Before using, check the product visually for particles or discoloration. If either is present, do not use the liquid. It is important to store and discard medical supplies safely. For the best effect, use this antibiotic at evenly spaced times, and try to use it at the same times every day to help you remember. It's important to continue using this medication until the full prescribed treatment period is finished, even if symptoms disappear after a few days. Stopping the medication too early may result in a return of the infection. Be sure to tell your doctor if your condition lasts or gets worse. Some common side effects of Zerbaxa Vial may include pain, redness, or irritation at the injection site, as well as nausea, diarrhea, or headache. It's important to tell your doctor if these effects persist or worsen. Remember, your doctor has prescribed this medication because they have determined that the benefits outweigh the risks. Most people using this medication do not experience serious side effects. However, it's important to seek medical help if you experience muscle cramps, weakness, irregular heartbeat, or signs of kidney problems. Additionally, a severe intestinal condition caused by a bacteria called C. difficile may occur, so contact your doctor if you develop persistent diarrhea, abdominal pain, or blood in your stool. Furthermore, prolonged use of this medication may lead to oral thrush or a new yeast infection, so contact your doctor if you notice any changes in your mouth or vaginal discharge. While rare, a serious allergic reaction to this drug may occur, so seek immediate medical help if you experience symptoms such as rash, swelling, dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed here. Remember, do not use this medication without the advice of a healthcare professional. Before starting Zerbaxa Vial, make sure to inform your healthcare provider if you have any allergies to cephalosporins, penicillins, or other antibiotics. Also, let them know about your medical history, especially if you have kidney disease. This medication contains sodium, so if you're on a salt-restricted diet or have conditions like heart failure or high blood pressure, consult your doctor or pharmacist before using it. It's important to note that ceftolozane/tazobactam may affect the effectiveness of live bacterial vaccines, so make sure to inform your healthcare professional before getting any immunizations or vaccinations. If you're planning to have surgery, inform your doctor or dentist about all the medications and products you're using, including prescription drugs, non-prescription drugs, and herbal products. If you're pregnant, only use this medication if it is clearly needed and discuss the risks and benefits with your doctor. It's unknown whether this medication passes into breast milk, so consult with your healthcare provider before using it while breastfeeding. It's important to be aware of potential interactions with other medications, as they may affect how Zerbaxa Vial works or increase the risk of serious side effects. It's a good idea to keep a list of all the products you use and share it with your doctor and pharmacist. Also, be mindful that this medication could interfere with certain lab tests, so make sure that the lab personnel and your doctors are aware that you are taking Zerbaxa Vial. If someone has taken too much Zerbaxa Vial and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. When using Zerbaxa Vial, your doctor may order lab or medical tests, such as a complete blood count or kidney function tests. It's important to attend all of your medical and lab appointments as scheduled. Be sure to consult with your doctor for more information about these tests. Be sure to take each dose of Zerbaxa Vial as directed by your doctor. If you happen to miss a dose, consult with your healthcare provider to establish a new dosing schedule. Do not take extra medication to make up for a missed dose. Be sure to follow the product instructions and consult with your pharmacist about the storage details for Zerbaxa Vial. It is important to keep all medications away from children and pets. Do not flush this medication down the toilet or pour it into a drain unless specifically instructed to do so. Make sure to properly discard this product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper disposal of Zerbaxa Vial. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.